Swastiastu. Good morning, doctor and friends. Today, Group B7 will discuss about Hemophilia A. Please enjoy.
Hello everyone, my name is Udayana with class 3 student number 021. So I'm going to explain about the background of our student project. Hemophilia is the most common congenital bleeding disorder that can be classified into two types, Hemophilia A and Hemophilia B. Hemophilia A is a congenital bleeding disorder related to X chromosome that caused by deficiency of factor VIII intrinsic pathway of blood coagulation. Hemophilia was first recognized back to the 2nd century AD, which was recorded in the Talmud file. It was stated that male babies should not be circumcised if two brothers had already died due to excessive bleeding from the circumcision. In a Hemophilia A patient, prolonged bleeding and occurrence of bleeding in vital organ can be life-threatening. It can cause chronic anemia, hematemesis, and intracranial hemorrhage. This disease could also cause hemorrhagic shock in acute bleeding due to trauma or surgery. Protein replacement therapy is the standard therapy that frequently used. However, these kind of therapy are expensive and uncomfortable. And judging from its complication, Hemophilia A should be taken seriously. Therefore, as a product of our student project in Hematology block, we'll explain about Hemophilia A and the details surrounding it. Thank you.
Hello, my name is Mani with the last 3 digits student number 249. So I'm going to explain about literature review purpose and benefits of this literature review. For the first part, it will be the literature review. What is the definition of Hemophilia A? What is the epidemiology, risk factors, pathogenesis, classifications, key diagnostic features, differential diagnosis, management, as well as the prognosis of Hemophilia A. The second part will be the purpose of this research. The purpose of this research is to understand the definition of Hemophilia A, to understand the epidemiology, to understand the pathogenesis, classifications, diagnostic features, differential diagnosis, management, as well as the last part would be to understand the prognosis of Hemophilia A. The last part will be the benefit of the research. The paper is useful for increasing knowledge and understanding as a medical student regarding Hemophilia A. This knowledge can be used as the basis for medical students so that later on they can fully understand about Hemophilia A. Thank you very much, and my friend will go to the next part.
Hello, my name is Dara Cynthia Augustine with my student number 069, and I would give explanation about the definition of hemophilia. Hemophilia is the most frequent inherited X-linked recessive disease which manifests with prolonged and excessive bleeding that could be spontaneous or after insignificant trauma. Hemophilia is classified into two types, which are Hemophilia A and Hemophilia B type. Although for this section we are only going to discuss about the Hemophilia A type. Hemophilia A, which is known as a classical hemophilia, is a type of blood coagulation disorder caused by a deficiency of factor VIII in the blood. Due to the disruption of the internal pathway during blood coagulation, this will lead to prolonged bleeding time. That's all for me. Thank you.
Hello, doctors and friends. My name is Zaki Arafi ID with student number 122. So today I will discuss about epidemiology of Hemophilia A. Hemophilia A is the most common manifestation of bleeding disorder. According to a survey done by World Hemophilia Federation in 113 countries, there are about 295,866 people who suffer from bleeding disorder, and almost 50% of them have been diagnosed with Hemophilia A. According to Sahil and Babikar, there are about 400,000 people that are possibly affected by hemophilia, and many of them remain undiagnosed in developing countries. Hemophilia A almost affects exclusively to male, with a ratio of 97% male to 3% female. Thank you.
Hello, good morning, doctor and friends. My name is Puto Andre Wisnu Sebastian with student number 143. So I'm going to explain about the risk factor of Hemophilia A. So, the only risk factor of Hemophilia A is the family history, which we can determine from the parent phenotype of the parents. There are 5 scenarios of parent phenotype, which are: the first, when the father is infected, there are 100% chance the daughter will be a carrier. Second, if the mother is a carrier, there are 50% chance either the girl will be a carrier or the son will be infected. The third, if the mother is infected, either the girl will have 100% chance to be carrier or 100% chance of the son to be infected. The fourth, if the father is infected and the mother is a carrier, there is a 50% chance that the daughter will develop hemophilia A or be a carrier, and the son will have 50% chance to be infected. And the last is when the father is infected and the mother is infected. Either the boy or the daughter will have 100% chance to be infected.
Hello, my name is Pratista and my student number is 227. So now I'm going to explain about the pathogenesis of Hemophilia A. Hemophilia A is one of the most common hereditary bleeding disease caused by a deficiency or dysfunction of protein coagulation, namely factor VIII. When there is a blood vessel injury, the first factor to be activated is factor XII. Factor XII will trigger the activation of factor 11 and 9, which will be assisted by factor VIII. Activated factor 8 and 9 together with calcium form tenacious complex, which activates factor 10, amplifies thrombin production, converting fibrinogen to fibrin, which leads to fibrin clot formation.
Hello, my name is Putri Indria and my last three number is 200, and now I'm going to talk about the classification of Hemophilia A. So based on the severity, Hemophilia A is classified into three types. The first is mild hemophilia, second is moderate hemophilia, and third is severe hemophilia. In mild hemophilia, there is no spontaneous bleeding and usually undiagnosed. Moderate hemophilia, there is no spontaneous bleeding unless it was triggered by minor injuries. And third is severe hemophilia, where in this hemophilia, there is spontaneous bleeding in the joints. That's all I can say about the classification of hemophilia. Thank you for your time.
Hello, my name is Nanda Pramesti with student number 167. Now, I'm tell about the diagnostic feature. Clinical diagnosis that can be found in a patient with hemophilia A. In addition, the first is the presence of hemarthrosis along with a minor or no previously trauma. The second is intracranial bleeding without previously trauma. The third is hematuria. The fourth is the poor wound healing after surgery or trauma. And the fifth is the prolonged and bilateral epistaxis. The laboratory features that can be found include normal platelet count, prolonged partial thrombolysis activation, and also normal perturbation time. In children and adults with untreated severe hemophilia, the risk of recurrent bleeding is 2 until 5 times greater each month, and individuals with moderate hemophilia A rarely experience spontaneous bleeding, but bleeding can occur if triggered by a minor trauma. And also, individuals with mild hemophilia A do not experience spontaneous bleeding, and the frequency of bleeding varies from once to once every 10 years. And mild hemophilia A is often diagnosed later in a lab when undergoing surgery, extracting a tooth, or experiencing trauma. Thank you.
Hello, my name is Shantika Aprilia Rahmawati with my student number 106. Here I'm going to explain the differential diagnosis of type A hemophilia. Type A hemophilia has a lot of differential diagnoses based on its major clinical feature, which is uncoagulated bleeding. The first is von Willebrand disease. The bleeding symptoms is very similar to mild congenital hemophilia. The major difference is mucosal bleeding, mostly happen in patients with von Willebrand disease. The second is platelet dysfunction. Different from bleeding type in hemophilia, which occurs in musculoskeletal, the bleeding in platelet dysfunction tends to be mucocutaneous. The third is deficiency of other coagulation factors. It can be factor 5, 7, 10, 11, or fibrinogen. This differential diagnosis can be achieved by carrying out specific coagulation factor assays in order to know which coagulation factors that have deficiency. The fourth is Ehlers-Danlos syndrome. Different from bleeding type in hemophilia, which occurs in musculoskeletal, the bleeding in Ehlers-Danlos syndrome is mainly mucosal in origin. There's also hyperextensible and hypermobility syndrome in skin. Thank you.
Hello, my name is Daniel Surmotama Sriringo, student number 045, and I'm going to explain about the management of hemophilia A. The main treatment for hemophilia is by CFC or clotting factor concentrate replacement. For hemophilia A, we use factor 8 replacement. To calculate the dosage, multiply patient weight in kilogram by the factor 8 level in international unit desired, then multiply by 0.5. Factor 8 CFC should be infused slowly over several minutes. To verify the expected factor 8 activity level of the dose given, the patient peak factor level should be measured in 15 to 30 minutes after infusion. Next, I'm going to explain about the prophylaxis in hemophilia. Prophylaxis in hemophilia consists of regular administration of therapeutic products for maintaining homeostasis to prevent bleeding. In hemophilia A, the prophylaxis would be regular intravenous infusion of the missing factor 8, given in order to increase the F8 level to prevent bleeding. Thank you.
Hello, my name is Udayana Sakti with a student number of 253 and I will explain about the prognosis of Hemophilia A. So the prognosis depends on the percentage of blood clotting factors and classified into mild, moderate, and severe hemophilia. Nowadays, with the proper and modern treatment and education available, patients with hemophilia can live a relatively normal life with the presence of prophylaxis and early treatment of factor VIII. Causes of death is mainly due to intracranial hemorrhage, hemorrhages into soft tissue around vital area, and the non-threatening complication with huge impact and carried through adulthood is chronic debilitating joint, causing membrane inflammation, hypertrophy, and destructive arthritis. The conclusion is, nowadays, with the advanced treatment, hemophiliac can live a better life.
Hello, my name is Butabinama Sadanardika with student number 239. Now I will explain about the conclusion of this topic. So, hemophilia A is a type of blood coagulation disorder caused by a deficiency of factor VIII in the blood. Hemophilia A is one of the most common hereditary bleeding disease caused by a deficiency or dysfunction of protein coagulation. The only risk factor of hemophilia A is a family history of the disease, that the risk is based on variant phenotype of the parents. Hemophilia is classified into two main types, that is hemophilia A and hemophilia B. The difference between these two types can only be established with specific coagulation factor assay. That's all about my explanation about this conclusion. Thank you.
That's all from our presentation. Thank you for your attention, and we close it with Paramasan. Om Santi Santi.